Hi guys, welcome to my channel. So for those of you who don't know me, my name is Bomika Azilupindo. I am ComServe clinical psychologist, and for those of you who are returning to the channel, welcome back. It's always great to have you. So it's that time of the year where people have to write board exams, and a couple of my friends are writing their boards as well. And they've been talking to me a lot about some of the concerns they have, feeling quite overwhelmed and anxious, and basically asking for information about what they need to know about preparing, and also in terms of the oral exam. So I'm hoping that this video is going to help you in terms of sharing information about the techniques that I used when I was studying for my board exams, and also helping to demystify some of the things surrounding the oral exam, because it is a relatively new process. So let's get right into it. So starting with the study material. So once you've registered for your board exam, you can either write in Feb, in June, or around October. And once you've registered and you know when you're writing your exam, the study material is available on the HPCSA website. So on the HPCSA website, where you get information about board exam, there's also information about study material. And make sure that you're getting information or you're downloading material that's specific to your registration. So as a clinical psychologist, I had to go look for information that was in relation to clinical psychology. I think there are about 15 documents on there, and those are the material that you will need to go through in order for you to prepare for the exam. So what I did was, I found it quite overwhelming when I got the material and I didn't know where to start. So I found it quite helpful by starting with things that are relevant specifically to psychology. So things like the Mental Health Care Act, your scope of practice, the Annex to 12, those kind of material felt familiar to me, and also that was material that was directly linked to psychology, and I think it helped me in terms of starting the process. So after that, then I started looking at material that was shared in our board exam group. So those were like books and other kind of summarized material that are linked to the study material for the board exam. So what I found was that kind of material was easier to digest and to understand than the material that was directly from the act itself, because it was more simplified. There was quite a lot of application and case studies, which is a similar kind of layout that you'll get for your board exams. And then after I went through that material, I then looked at everything that was on the HPCSA page. So to be honest, I felt quite overwhelmed when I looked at those acts, because for some of them, I couldn't understand the jargon because it was more legal jargon, and I'd find myself losing my trail of thought or finding it difficult to follow what I had read and what I had not read. So having went through the material where it's a more simplified version of it, or a more lay kind of explanation of the act, I found that to be quite helpful. And then after I had went through all the material that I had for studying, I then looked at past papers. To be honest, when I went through the past papers and I looked at the questions, I was just like, oh my goodness, what on earth is going on here? Because the questions are more application questions. So they'll ask you questions relating directly to you as a clinical psychologist or counseling psychologist or educational psychologist. And they'll ask you to apply your knowledge. And when you're going through the study material, it's not easy to figure out, this is how I'm supposed to apply this knowledge that I have learned. So you have the information there, but it feels like you don't know anything, because the way in which the questions are asked is different from the way in which the information is presented in the study material. So what I found helpful is that I started going through the case studies as a way of studying whatever acts that were there, and trying to see, okay, so based on the case study, how can I then understand the case study in terms of applying laws and ethical codes to the case study? So for example, if the case study is about a minor and there are things like virginity testing, abortion, sexual abuse that's happening there. So I would need to know things like the age of consent of the child. So I'd need to go look at acts that speak specifically to that. So things like the Children's Act, the Sexual Offences Act. So that would give you information in relation to if you're dealing with a sexual case and a child is involved. These are all things that you need to consider based on that information that relates to the case. And then also things like if a child is involved, the role in which the parent plays and the consent in those kind of situations. If there's no parent, then who is the legal guardian of the child? Also considering the procedure for reporting if there's something such as child abuse that's happening specifically in that case, and also considering your role as a psychologist. So what does the scope of practice say? Where does your role start and end? Who are the other parties that would have to be involved in that kind of situation? And also the decision-making process that you'd have to take. And most importantly, mentioning that you would consult in that situation, especially because you are quite a novel psychologist. And just as a last tip in terms of studying, I also find it quite helpful to have a study partner, because then we'd be able to bounce off ideas in terms of this is what I'm able to understand, this is what I'm not able to understand. And also when we were feeling quite overwhelmed, having a partner kind of normalized that feeling of feeling overwhelmed and not being certain about certain things, and actually having someone you're going through the process with. And also what we found to be helpful was that even though we didn't attend the board exam preparation workshops, we actually looked at a couple of the workshop brochures. We found one that we actually wanted to attend, but the problem was the cost was too high, and when we found one where we were willing to pay that price, it actually clashed with when we had to be at our internship sites, because some of them were over a couple of days and it was during the day and the sessions weren't recorded. So we just felt like it's not going to be possible for us. But what was helpful is that we looked at the content that would be covered in the workshops. So for example, a lot of them would look at the Mental Health Care Act, Annex 12, the Children's Act. So we then focused specifically on those acts and we paid more attention to them, because if that's what the workshop is focusing on, it means that those ones are quite important. Yes, all the other acts that are there are important because it's things that you can be asked about, but those were the ones we focused specifically on because that's what the workshop was going to give us more information about and give us a better understanding in relation to. And now in terms of the actual structure of the oral exam, so what happened was they sent me an email I think like 30 minutes before the actual exam, and they notified me that 15 minutes before the exam they would send an email with the case study. I think the first email is also just to check whether or not you're receiving their emails and you guys are able to communicate with each other. And then about 10 to 15 minutes before my actual exam time, they sent the case study, and it was just the case study with no questions. So when you do receive the case study, what I found helpful is that actually look at the case study. So what is the dilemma within the case study? So what are the ethical issues that you're already foreseeing in this case study? What laws and legislations would you need to consider in this particular case study, or what laws and ethical codes are being violated in relation to the case study? And also think about, what is my role as the psychologist in this specific dilemma, and who are the other stakeholders would I need to involve? So consider things like, where does my role start and end? Who else do I need to involve? What is required of me in this specific setting? What things do I need to look out for? So for example, avoiding dual relationships. Those kind of things are important to think about beforehand and preempt yourself in terms of how you would deal specifically with this case study without receiving the questions. And also thinking about, okay, so what don't I know in relation to this case study, and what can I consult about, and who can I consult in relation to the things that I don't know or things that I'm uncertain about, and what is the decision-making process that I would take in this specific case study. So yeah, I think that's something that I did and I found quite helpful in order to prepare myself for the actual questions that they asked. And then when it came to the questions, so first things first, what you need to understand, especially for me, like as the clinical psychologist, I had to understand that my role is to assess, to diagnose, to formulate, and to intervene. So when I was thinking about the case and coming into the questions, those are the things that I was already anticipating. So already by looking at the case study and thinking about these issues and dilemmas, the code of ethics, the laws and legislations, stakeholders that involved, those things are already preparing you in terms of the actual assessment that you would have to do in relation to the case. So they can ask you questions around that. So what assessment procedure would you do or would you undertake in relation to this case? So what would you do? Clinical interviews, maybe you'd want to do, if it's in relation to a child's performance, you'd want to do psychometric assessments. If you want to confirm a diagnosis, you would want to maybe use even other screening tools that would help you in terms of confirming the diagnosis. If it's a child and it's scholastically related stuff, also doing assessments in with teachers, so clinical interviews with the teachers. Of course, considering like ethical stuff you'd need to take in relation to that. So things like getting consent from the parents before you even do those assessment stuff. So the second aspect of what we do, and another question they can ask you, is in relation to diagnosis. So based on the assessment that you've already done and thinking about the case itself, so what diagnosis would you give in the specific case? And once you've given a diagnosis, what differentials did you consider and why? So why did you disregard these ones and make this one as the primary diagnosis? And why did you keep these ones as the differential diagnosis? So they want to see your logic behind those kind of things, and how you understand those kind of things. And also in terms of assessments, they can ask you things like, how would you make sure that the assessments are standardized? How would you make sure that if it's an international kind of assessment that you've mentioned, so for example, if you say you'll use the WISC instead of the S size or the J size, then they'd ask you, why is it that you use that one instead of this one? How would you make sure that it's standardized and it's not biased against that specific population that you're using it in, so specifically within the South African context? After that, they might also ask you questions around formulating, so using the biopsychosocial model to understand the causes of the current presenting problem, and the maintaining factors around that. So usually with those kind of questions, they might not be as direct in terms of, okay, so we want you to think about how you would formulate this case. They might ask you a question like, how would you understand the role of genes and psychosocial problems in terms of describing like maybe an XS1 diagnosis. So then you would need to understand that, okay, so my other role as a psychologist is to formulate, and how I formulate is using the biopsychosocial model. And then also then the last part is thinking about the interventions that you would want to do, the people you would involve, why are you choosing that specific intervention given the diagnosis that you gave as the primary diagnosis. So mentioning things like that for depression, this is what has been found to be an evidence-based therapeutic intervention, and it has been found to be effective, and based on the formulation you made, that's why it's important to think about those kind of things. And then also when you are answering your questions, be it it's an ethics question or a legal kind of question, or even thinking about your role as the psychologist and how your role differs from like maybe a clinical psychologist differs from an educational psychologist, and things you would need to consider in terms of your scope of practice, then it's important for you to mention where you are getting that information. I think when I asked last year's ComServes who had already written the board exams, that thing of you have to know which act you're referring to, it made me feel so anxious because it's already so difficult to memorize the information that you are getting. But it's important to say, according to the Mental Health Care Act, this is what it says. According to the Children's Act, these are the things that need to consider. According to the Criminal Justice Act, this is what I need to consider when I'm thinking about state patients, when I'm thinking about whatever it is that you are speaking about in relation to the case study, because it helps them understand that you know where this information is coming from. You understand how to apply this information in terms of your role as the psychologist. And other things that I found to be quite important when you are studying and things you need to consider. So things with regards to minors and people with disability, be it intellectual disability or any other kind of disability, acting in the best interest of the client, given those kind of things that you're considering. There's 72-hour process. So knowing what you need to do when you need to get an involuntary patient admitted. I found that they actually liked that question, not only on the board exams, but also interviews that I've started attending. So that is quite important. And with the whole COVID pandemic and people moving more to telehealth, so ethical considerations you would need to take around things like privacy and confidentiality, things like risk when you have a suicidal patient. What do you do in that kind of setting? And what would you need to prepare beforehand in order to make sure that you're keeping your patients safe? So I think those are also important considerations that you should hold in mind. So I think that pretty much sums up what I wanted to share about the board exams. And I think the most important thing is that when you do get to that exam, understand that you will not be able to say every single thing that you studied. You might walk out of that exam feeling like, actually, I had so much more I could have said, and you start becoming even more aware of other information that you could have given. But I think if you get like the crux or the basic kind of points across, that's the important thing, because they just want to see, do you understand the material that you learned? Do you know how to apply this material that you learned? How will you use it in your everyday practice as a psychologist once you are done with your training? And I think that's the important thing, which is why it's important to also mention where you're getting the information so that they know, okay, so should this person need further information, they know exactly what to refer to. And I also found the actual exam, it's helpful to have the oral exam in the sense that you get probed if there's more information that they want from you. I was even asked, because they kept asking me, okay, so what other differential diagnosis would you consider? And I kept trying to think, and in that moment you're so anxious. Then eventually she was like, what about this one? And I'm like, yeah, actually I would need to consider that because of A, B, and C. So she was able to see that as much as at that time, because of the setting itself, I was not able to think of it on the spot, but I knew why it was important to consider it. And I think that's what they want to see. The exam is a bit more trickier than the written exam because you have more time to reflect on things. But overall, personally for me, I think I preferred the oral exam, even though I've never done the written exam. I found that to be, the process was a lot shorter. And also you had people that kind of guided you in terms of, okay, so tell us more about that. So this brings us to the end of our video. I do hope that this video is helpful for you guys. And if there's any other questions that you would like to ask and anything you would like to share that you feel might be helpful for other people that are going through this process, please do feel free to do so. And I wish you guys the best of luck. Just remember, everyone went through this process and there's no reason why you won't make it. And I feel like, especially if you do the board exams during your internship, there's a lot more pressure. So finding a balance between making sure that you're finishing off your internship stuff, but also making sure you're paying more attention to the board exam and putting in as much effort as you can. For me, I studied for a month in advance, and that's because I mostly studied after work, and most times I was tired, so I could only get through maybe one document and do one case study. So giving yourself enough time to panic, to feel relaxed, to feel confident, and then you panic again, that's usually quite helpful. Otherwise, thank you so much for tuning in, and please do give it a thumbs up if you did find the video helpful, and also comment in the comment section below. Let me know your thoughts. Let me know if there's anything else you'd want to see on the channel, and I'll catch you guys next time. Mwah.